Good afternoon. Thank you, Caroline and Terrence. Please let me first start by acknowledging our Health Resources and Services Administration's most senior maternal and child health bureau leader, Associate Administrator Michael Warren. You will hear more from him in a moment and throughout the summit. Also, to my office's most senior leader, Director Natasha Kaloris. These two are outstanding, forward thinking leaders. We at HRSA are fortunate to have them. I am super excited. This day is finally here. A time for Region 5 to pull together and foster change, the kind designed to improve the health outcomes of our Region 5 infants. Over the past year, it has been an absolute joy and a labor of love to work alongside this awesome planning team. Again, I am Tamara Cox. I serve as the Regional Administrator for the Health Resources and Services Administration for Region 5 Chicago. I am with the newly named Office of Intergovernmental and External Affairs. My office was previously referred to as the Office of Regional Operations. So, from the entire HRSA Region 5 based team, welcome. Now, I really have the easiest job of the summit, and that's having the honor to introduce you to the U.S. Department of Health and Human Services most senior health official in our region, Dr. Joshua Devine. In addition to his role as the most senior health official, he is also serving as the acting regional director. The regional director is a politically appointed position by our country's current presidential administration, in this case, the Biden Harris administration. But before I let you hear from Dr. Devine, let me tell you a little bit about him. Captain Joshua Devine is the Regional Health Administrator for Region 5. As I mentioned, he serves as the most senior federal public health official in our region, providing leadership and support for the work of the department, with a special focus on public health in action. Captain Devine has served as an officer in the Uniformed Services, managing healthcare programs for over 20 years. Yep, you guessed it correctly. He is a child prodigy. He received his PharmD from Drake University and his PhD from the University of Minnesota. Dr. Devine is board certified in pharmacotherapy and is a fellow of the American Pharmacists Association. He holds numerous awards and accolades from the U.S. Air Force and the U.S. Public Health Service. So now, please join me in welcoming my colleague, my friend, Captain Josh. It's all yours, sir.
Thank you, Tamara. And I really appreciate the kind introduction, as well as your tremendous leadership for HRSA and Region 5. And let me just add my welcome as well. It's my honor, really, to say good afternoon. And on behalf of our HHS Secretary, Javier Becerra, I'd like to welcome you to our Infant Health Equity Summit, focused on eliminating health disparities in infant health by 2030. As part of my welcome, I wanted to acknowledge the outstanding group who helped make the summit possible, to our partners at AMCHIP and CityMatch, as well as our colleagues at HRSA, both in the Maternal Child Health Bureau and our regional team. Thank you for putting this event together. I realize an incredible amount of work went on behind the scenes to help make this day possible. So I want to specifically call out and recognize the planning team, professionals from each of these organizations who helped make this happen. It is so appreciated. And I thought, as I'm representing the HHS Region 5 office, I'd start today by just sharing a bit more about who we are and spotlight a few of the details about the region as a whole, just to help everyone get to know us a little bit better. The HHS Region 5 office is based in Chicago, Illinois, and we're fortunate to serve 6 Midwestern states that are home to approximately 53 million Americans. Our region is notable in that each state borders at least one of our Great Lakes, and it consists of large metropolitan cities, vast suburban areas, lakefront beaches. Believe it or not, people don't often think about that in the Midwest, but it's true. And also acres of farmland in the rural heartland of our country. Our region is also home to 34 federally recognized American Indian tribal governments, and we are proud to claim a diverse population with many cultures and languages. In addition to our awesome HRSA team in Region 5, the regional office includes other HHS divisions, some of which will be participating today. For example, our Office of Intergovernmental and External Affairs, as well as our Office of the Assistant Secretary for Health, which I have the proud opportunity to lead. These offices include regional advisors from our HHS Office of Minority Health and Office on Women's Health, which have throughout their time in the region been working closely on addressing health disparities. And I want to say that these offices, along with our other operating divisions in the region, stand ready to support the work of this summit as we move forward addressing the challenges of racial disparities in infant health. During my time at Health and Human Services, I've seen the department's ability to make a difference in people's lives. I think our mission says it clearly: to enhance the health and well-being of all Americans. And in the HHS regional office, we strive to meet this mission. And we prioritize maintaining close contact with our state, local, and tribal partners to help address the needs of our communities and individuals that are served through our programs and policies. As a father, I know there's nothing more important than the health and well-being of a mother and baby. And our department is prioritizing efforts that are focused on promoting maternal and infant health and also to ensure equitable access to affordable and high quality care for our nation's families. Earlier this morning, I had the privilege to accompany our HHS secretary, who's actually traveling in our region this week. He began his visit in Chicago at a maternal health roundtable hosted at a community health center in the west side of Chicago. He was joined by Congresswoman Lauren Underwood from the Illinois 14th Congressional District, who's been a long leader in the area of maternal health, as well as advocates and moms here in Chicago and in Illinois to discuss the department's efforts to address maternal and infant mortality. We also talked about how the Momnibus, which is a set of bills that was introduced by the Congresswoman and other members of the Black Maternal Health Caucus, build on these efforts. And it was truly a wonderful discussion and opportunity to lift up this important issue and promote some of the ways that I think we can make a significant progress toward improving maternal and infant health. I'm also excited and wanted to share a little bit about another event that's happening today while I'm speaking. Actually, our region is hosting an Affordable Care Act event. The ACA, as we often abbreviate it, we're doing this event, as we're in open enrollment at the Chicago AIDS Foundation here to mark the second week of open enrollment. And the event's going to detail Biden-Harris efforts to increase access to affordable care, which remains a critical element in our effort to reduce maternal and infant mortality. Now that open enrollment has begun and our region continues to work very diligently to get more people covered, including moms and mothers-to-be. And I think this is so important because, if we look back, thanks to the ACA, we understand that uninsured rate, particularly among women, has decreased 39% from 2010 to 2019, down to just under 10%. Also, thanks to the ACA, marketplace plans cover preventative services at no cost to women. And thanks to the Affordable Care Act, all new health coverage policies include maternity benefits. And I just want to conclude by saying that thanks to President Biden and the American Rescue Plan, we now have the opportunity to expand affordable care, and we're working to do just that. Just a couple of brief highlights. Earlier this year, more than 2.8 million people took advantage of lower health insurance premiums during our marketplace special enrollment period, which ran from February to May, and millions more have gained in health insurance coverage through Medicaid. This is, I think, significant progress, and we look forward to continuing this during the open enrollment period, which just began last week on the 1st of November, will end January 15th of 2022. However, despite the gains we've seen in coverage, today in 2021, we know that maternal mortality in the U.S. is higher than most other developed and high-income countries. With pregnancy-related mortality for Black and American Indian, as well as Alaskan Native women, standing about 3 and 2 times higher compared to their white, Asian Pacific Islander, and Hispanic counterparts. And if we focus on infant mortality rates, the focus of our summit over the next 2 days, we see similar disparities across racial and ethnic groups. And I know we're going to talk more about this. I believe Dr. Warren's going to be covering this in the next presentation. But just looking at our Healthy People 2030 objectives, which are the national objectives to really help us improve our health and well-being as a country over the next decade, you'll see that when you stratify infant mortality rates by race and ethnicity, only non-Hispanic, Black, and American Indian, Alaskan Native infants have not yet reached the Healthy People 2030 targets. And I think you'll see in the data as we get into this in later presentations that, in fact, these groups have not yet reached the original Healthy People goal established for 2000, which was established more than 30 years ago. I know we'll hear much more about this data later today, but I wanted to acknowledge it during my remarks and make it clear that we understand there is more work to do, and we are committed to doing this work. Now, before I wrap up my remarks, I wanted to make special mention about something that I think will likely be obvious for many on this call, but I think also the data shows us that we need to talk more about it, and that is the importance and the safety of COVID-19 vaccines to women and moms to be. Because I think what we're seeing today is that there are very low rates of pregnant women and those who may become pregnant who are getting vaccinated. The Centers for Disease Control, or CDC, recently issued a health advisory on this very topic, the end of September, recommending urgent action to help increase COVID vaccination among people who are pregnant or might become pregnant. Just a couple of notes about kind of where we were at the time this advisory was issued, the end of September. We had more than 125,000 COVID cases that had been reported in pregnant people, including more than 22,000 who'd been hospitalized and more than 160 deaths. And I thought probably the most significant part of that announcement was that the highest number of COVID-related deaths in pregnant people in a single month of the pandemic was reported in August 2021, just the month before this advisory was issued. So let me just state the facts as we understand them today. First, virtually no vaccinated person has had a severe breakthrough case of COVID-19. Also, 99% of Americans dying from COVID are unvaccinated Americans. And these vaccines are safe and effective, including during pregnancy. The benefits of vaccination far outweigh any risks to mom and baby. With the help of trusted community voices, like the ones in this summit today, I know we can get the vaccination into the arms of mothers and moms to be in this country. I know it can be done because I've seen the progress we've made in the vaccination rates across our region and the country as a whole, despite initial vaccine hesitancy by many. This is clear evidence that we can make a change to the status quo, but as with all the progress we've made combating COVID, it takes all of us working together toward a shared purpose in order to make meaningful progress. So in closing, on behalf of the Department of Health and Human Services in Region 5, I would like to once again express our gratitude for the effort and commitment of our planning committee partners at HRSA, as well as at AMCHIP and CityMatch, for organizing today's summit. And to all of you who joined us in this summit, it's heartening to know that we are in this fight together and that we will not let this opportunity to work on the elimination of racial disparities in infant health pass us by. Thank you so much for your time this afternoon. We will see you all in the next session.